House Bill 1306. Imagine this. A justice of the peace is called to the scene of a sudden death. While conducting the inquest, she is exposed to a contagious disease. Later, she is told by the county, not her employer, will decide if her medical costs are reimbursed, and only if the exposure happened during that specific inquest. What the bill says it does? House Bill 1306 says it extends first responder style protections to death investigation professionals, giving them reimbursement for medical treatment after dangerous exposures, access to preventive immunizations, and survivor benefits for their families. What it actually does? It gives those professionals some long overdue protections, but it limits them to exposures that happen only during an inquest. It also makes counties, not state agencies or employers, pay for those medical costs. This means some workers may still fall through the cracks, and counties could face new costs they didn't budget for. Who benefits? Death investigation professionals who qualify under the new rules, their families who now qualify for line of duty death benefits, and law enforcement and justice of the peace associations that back the bill. Now, who pays the price? County governments that must now cover these open ended medical reimbursements, taxpayer in smaller or rural counties that may struggle to afford them, other injured workers whose compensation cases may move slower as these are fast tracked. Why this matters. The people who handle our toughest scenes deserve protection. But when the state creates new mandates without funding them, smaller counties may have to cut services or delay care. A good law on paper can still create real world gaps if it leaves local communities holding the bag. Now, questions to ask your lawmakers. How will small or rural counties afford these new medical costs without state help? Should exposures outside formal inquests, like body transport or lab work, also be covered? Will the state track how these new costs affect local budgets and other workers' claims? Bottom line, House Bill 1306 protects vital workers but shifts the cost and risk to local counties, creating uneven protections across Texas.